Hello and welcome to True Pathfinder, your portal to health and truth. And in this video we are going to talk about bradycardia. What is it? What are the symptoms you have to look out for? The causes? Why do you have to resolve this health condition? And how can you do it naturally and, most importantly, successfully? Let's find out. So what is bradycardia then? Most of you have probably heard about tachycardia, that is a high heart rate, and bradycardia is its counterpart. It's a slow heart rate, so it's a cardiovascular condition. The coronary arteries and the veins run along the heart's outer surface in a crown-like shape, a coronary shape, and the two coronary arteries branch off from the aorta near the top of the heart. Their primary function is to deliver oxygen-rich blood to the heart muscle. Contrary to other blood vessels, the inner lining of the coronary arteries, the so-called intima, consists of susceptible squamous epithelial cells that originate from the ectoderm and are therefore controlled by the cerebral cortex. The arterial wall is composed of smooth muscle and striated muscles. The coronary arteries are descendants of the pharyngeal arches, which consist of pharyngeal arch arteries that give rise to several significant streets. And the coronary artery intima is controlled from the right insula, which is part of the temporal lobe. The control center of the coronary arteries is positioned across from the brain relay of the coronary veins, the trophic relays of the diaphragm, and the myocardium house the AV node border on the insula from within. And the insula is located deep in the cerebral cortex, precisely where the four cerebral cortices meet, namely the premotor sensory cortex, the motor cortex, sensory cortex, and the post-sensory cortex. It is the area of the brain that controls the lining of the large blood vessels, so the coronary arteries, the veins, the aorta, the carotid arteries, and the subclavian arteries, which deliver blood to and from the heart. The right and the left insula also regulate the slow and fast heart rate of the ventricles, so the bradycardia and the tachycardia. The bradycardia heart rhythm center is in the right insula and the tachycardia heart rhythm center is in the left insula. The heart rhythm constitutes a superordinate system with diaphragmatic breathing. The coronary arteries, the ascending aorta, the internal carotid arteries, and the inner sections of the subclavian arteries share the same control center and therefore the same biological conflict, and this determines which one of these arteries will be affected. The carotid sinus is also controlled by the same brain relay but is linked to a different biological conflict. As with all other health conditions, one of the possible causes of bradycardia is a so-called biological conflict. And the biological conflict linked to the coronary arteries is a male territorial loss conflict or a female sexual conflict, depending on the person's gender, laterality, and hormone status. A territorial loss conflict is experienced through the loss of the private domain, meaning a home, because of an unexpected move or a divorce, the confiscation of the property, fire or flooding, or a threat to the safety of the place where you live. Assets of the territory that are of personal value, such as a car, jewelry, a private collection, stocks, investments, a license, immigrant status, a club membership, they all also fall into this category. The loss of a professional domain could occur through the loss of a business, bankruptcy, the loss of a workplace because of layoffs or mergers or transfers, or early retirement due to illness or cutbacks. Not being able to continuing or pursuing the hobby that you love, such as playing a musical instrument or painting, writing, etc., can also be perceived as a territorial loss. And the conflict also refers to the loss of the intellectual domain, for instance, to the loss of one's skills due to an accident, or literally to the loss of intellectual property, such as research results, confidential data, patents, and trade secrets. Losing a territory member, such as a parent, spouse, partner, child, a pet, friend, colleague, client, or customer, because of an argument, for example, or separation, can also prompt such a conflict. Men also suffer territorial loss conflicts when they lose a sexual mate. The male territorial loss conflict is the equivalent to the female sexual conflict. The brain relays of the corresponding organs, namely of the coronary arteries and the cervix, are positioned exactly across from each other in the cerebral cortex, as you can see in the picture here on the right also. If a man at any age can no longer have territorial loss conflict due to a low testosterone status, a mating conflict, so loss of a sexual mate, sexual rejection or sexual frustration, affects the prostate more likely than the coronary arteries. And this explains why prostate-related symptoms such as elevated PSA levels or prostate hyperplasia are more common in older men. All biological conflicts have two phases: the conflict phase or the conflict active phase and the healing phase. During the conflict active phase, ulceration occurs in the coronary arteries inner lining, and the biological purpose of the cell loss is to widen the lumen of the coronary vessels so that more blood can flow to the heart. The enhanced energy puts the individual in a better position to get the territory back or establish a new one. The ulceration of the sensitive intima causes angina pectoris, and depending on the degree of the conflict, the chest pain ranges from mild to severe. The brain CT scan that you can see here on the right shows the impact of such a territorial loss conflict in the brain relay of the coronary arteries. The sharp border of the edema focus reveals that the person is in the conflict active phase. During the first part of the healing phase, the tissue loss is replenished through cell proliferation with swelling due to the edema, and the swelling might temporarily occlude the affected artery, particularly with concurrent water retention. However, a narrowing of the coronary vessel can never lead to a heart attack because, should the situation of an occlusion arise, auxiliary vessels, or so-called collaterals, act as a natural bypass to supply the heart with blood. And this refutes the standard theory that claims that a heart attack is caused by coronary artery obstruction. It also puts into question the need for bypass operations or angioplasty, and we did an in-depth video on this subject. I'm gonna link it down below. Study by Rentrop and colleagues in the 1988 April issue of the American Journal of Cardiology has produced results that are completely at odds with the coronary artery blockage theory. In an accompanying editorial, Dr. Stephen Epstein of the National Heart, Lung and Blood Institute summarizes the observations from this study in the following way. They found that in an advanced state of narrowing of the coronary arteries, the blood supply to the heart muscles is fully assured via collaterals that enlarge naturally in response to the blockage. Interestingly, they observe that the more the coronaries narrow, the less danger there is of a heart infarction. And therefore, heart bypass would be redundant to a large degree. Furthermore, bypass operations don't prolong life or prevent future heart attacks. Nor does angioplasty, in which narrowed vessels are expanded and typically propped open with metal tubes that are called stents. And this quote stems from a book called Is Heart Surgery Worth It? By Dr. L. David Hillis, who is professor of cardiology at the University of Texas Southwestern Medical School, and this appeared in 2005. When it comes to heart attacks, we also have to discuss the cholesterol levels. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a Patreon from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. For the holistic care you need and deserve, do not hesitate to contact us at christine.doctor. We can help you with your bradycardia, tachycardia, and all other chronic health problems. We do this remotely, naturally, and holistically. And check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links, of course, in the description box below. And there are still a couple of biosphere optimization systems left on sale, so be quick. If you don't know what a biosphere optimization system is and what it can do for you, have a look at our last video, the winter sale video. I'm gonna link it down below, and this explains why it is such an awesome device and why you should take advantage and get one for yourself. Alright then, so when it comes to cholesterol, the lining of the coronary arteries is restored predominantly with the help of cholesterol, and hence, during the healing phase, the cholesterol level rises. Cholesterol is mainly produced in your liver, and this is because 80% of the total cholesterol is synthesized within your body. Only 20% comes from dietary sources. The liver uses instead food fats as raw materials to manufacture the cholesterol in the body. The so-called LDL cholesterol, labeled as the bad cholesterol, is actually beneficial as it is very sticky and ideal for repairing the blood vessel walls. Cholesterol-lowering medications such as statins suppress the liver's cholesterol production, and therefore statin drugs hurt the liver. They also damage muscle tissue, including the heart muscle tissue, which of course is detrimental to the heart's overall function. Linking the elevated cholesterol and the onset of a heart attack is a fundamental error in scientific reasoning. Cholesterol is important for cardiovascular health. It is not detrimental. It is necessary in any cellular repair. And this statement comes from Dr. Ron Rosedale, who is a medical doctor and who wrote a very interesting book, The Cholesterol Myth. We did a presentation, by the way, on the cholesterol myth. I'm going to link it also down below for you. During the healing phase of the coronary arteries, the blood pressure is in a normal range, and this explains why, according to medical records, many heart attack patients did not have elevated blood pressure before the heart attack. The healing process is a critical moment when a heart attack may occur, and contrary to common belief, the heart attack is not caused by an occlusion of a coronary artery, but initiated in the brain precisely when the brain edema that developed is expelled through a sympathicotonic surge that is triggered by a brief pre-programmed reactivation of the conflict. From a biological point of view, a heart attack is crucial since the heart can only resume its normal function after the brain edema has been pressed out. And this critical moment may happen 3 to 6 weeks after the conflict resolution. However, a heart attack is most likely fatal if an intense conflict lasts for more than 9 months. With more water retention due to an active abandonment and existence conflict, the heart attack is more dramatic since the retained water enlarges the brain edema significantly. A heart attack might die after 5 to 6 months of conflict activity, so the risk for a heart attack, and it also has to be said that if the conflict active phase is shorter than 4 months, the symptoms are mild and you might not even notice them. And this observation only applies to the coronary vessels. I highly recommend for cardiovascular health and a healthy heart to always take your high-strength G-strophantine. Contact us at christine.doctor and we can help you out with obtaining it. We've done a presentation on the amazing benefits of G-strophantine that I'm also going to link down below for you. The heart attack linked to the coronary arteries presents itself as an acute angina pectoris with strong pain behind the sternum. The pain might radiate into the left shoulder and left arm, and accompanying symptoms are cold sweats and nausea. Since the striated muscles of the coronary artery wall undergo the sympathicotonic crisis at the same time, heart vessel spasms occur together with the angina pain. These muscle cramps are entirely unrelated to the myocardium, which is controlled from different parts of the brain and linked to an overwhelmed conflict. During the contractions of the coronary artery muscles, cholesterol plaques from the intima might come loose and get carried into the bloodstream, where they are washed out in the normal course of the blood flow. All patients in this phase are controlled from the sensory, postsensory or premotor sensory cortex, and this is accompanied by a troubled circulation, dizzy spells, short disturbances of consciousness, or a complete loss of consciousness or fainting, depending on the intensity of the conflict. Another distinctive symptom is a drop in blood sugar that is caused by the excessive use of glucose by the brain cells. The real danger of the heart attack is the involvement of the bradycardial heart rhythm center. Normally, the heart beats in a regular balanced rhythm, which changes for the duration of the brain edema in the coronary arteries when they are expelled. And the pressure created by the momentary sympathicotonic surge slows down the pulse, causing the bradycardia. Recurring episodes of bradycardial arrhythmia are triggered by conflict relapses. Dr. Hammer had the following to say on this subject: we viewed the loss of consciousness that occurs as particularly dramatic. With 3 to 4 heartbeats per minute and even very flat breathing, a person can stay alive for a long period of time, basically until the often long-lasting absence and a slowdown of the pulse is over. And the ECG provides, in such cases, the evidence. With a very intense, large brain edema, the heartbeat could even come to a complete stop, so a cardiac arrest. In conventional medicine, bradycardia is thought to be caused by a blockage of the electrical conduction system at the AV node, and therefore is referred to as an atrioventricular block or AV block. Dr. Hammer's research shows that the function of the AV node is 0, however. Let's look at some cases. In the first picture here on the left, you see a CT scan that shows a brain edema, so fluid accumulation in the control center of the coronary arteries. The edema has developed after the territorial loss conflict was resolved, and water retention due to the syndrome enlarges the edema considerably. The significant brain edema in this part of the cerebrum might press onto the motor cortex, specifically during the sympathicotonic crisis when the actual heart attack occurs, and the involvement of the motor cortex results in a temporary paralysis on the left side of the body. In conventional medicine, the dark hypodense area on the brain scan is interpreted as a brain infarction, believed to be caused by a blockage of a cerebral artery. The glia ring in the coronary arteries relay indicates the beginning of the healing phase. In the second picture, the brain scan was taken shortly after the expected heart attack. In conventional medicine, the presence of this glia is diagnosed as a brain tumor, precisely as a high-grade glioblastoma, white on the outside and with a necrosis in the middle. However, this brain CT demonstrates that neuroglia, so the brain connective tissue, starts restoring the brain relay from the periphery. And this contradicts the established theory that cancer, including brain cancer, grows through continued cell augmentation, leading thereby to tumor formation. Based on the established brain tumor theory, conventional medicine classifies the white hyperdense area as a grade 4 glioma with a very poor prognosis. However, according to modern German research, the buildup of neuroglia is a positive sign that the healing process in the coronary arteries is almost complete. On September the 6th, 1984, Dr. Mannheimer from the cardiology clinic in Vienna and Professor Pockiser, together with Professor Dr. Imhoff, both radiologists at the University of Vienna in Austria, tested Dr. Hammer's findings of the correlation between heart attacks, territorial loss conflict, and alterations in the brain, which are visible as this Hammer foci or Hammer hertz that you see in the CT scans, and their results confirmed that all heart attacks had occurred after the territorial conflict had been resolved. Another possible cause for bradycardia is a problem with the carotid sinus, also known as sick sinus syndrome. What is the carotid sinus? As you can see also here in the pictures on the right, it is a bulbous area that is located bilaterally on both sides of the neck, close to where the carotid arteries bifurcate. The carotid sinus contains pressure receptors that control the body's blood pressure by mediating changes in your heart rate, and the lining of the carotid sinus consists of squamous epithelium that originates from the ectoderm and is therefore controlled by the cerebral cortex. The carotid sinus is controlled from the right insula, which is part of the temporal lobe. The insula is located deep in the cerebral cortex, where the four cerebral cortices meet, and their control center is positioned across from the brain relay of the coronary veins. The carotid sinus shares the control center with the brain relays of the coronary arteries, the ascending aorta, the internal carotid arteries, and the inner sections of the subclavian arteries. During conflict active phase, we observe ulceration in the carotid sinus that is proportional to the degree and duration of conflict activity, and the biological purpose of this cell loss is to lower the blood pressure. And therefore, continuous, intense conflict activity causes carotid sinus hypersensitivity with a marked bradycardia and a drop in blood pressure. During the first part of the healing phase, the ulcerated area is replenished through cell proliferation, and the carotid bulb is repaired predominantly with cholesterol. with a hanging healing, the accumulation of cholesterol plaque called carotid bifurcation atheroma, narrows the lumen of the carotid artery. Here are some of the symptoms of thick sinus syndrome, also known as sinus node disease or dysfunction. It is a relatively uncommon heart rhythm disorder. This thick sinus syndrome is not a specific disease, but rather a group of signs or symptoms that indicate the sinus node, the heart's natural pacemaker, is not functioning correctly. When the symptoms occur, they might include the following ones: slower than normal pulse, fatigue, dizziness or lightheadedness, fainting or near fainting, shortness of breath, chest pains, confusion, and a sensation of rapid fluttering heartbeats. Symptoms and indications for a weak heart in TCM are heart Qi deficiency, Qi and YIN deficiency, heart Yang deficiency, heart and Yang kidney deficiency, heart blood Yin deficiency, heart blood and spleen deficiency, Ju Yin cold and heat, and blood as well as Yang deficiency with cold. As you can see, with bradycardia, as with most other chronic conditions, the causes can be manifold, and that's why you should not self-medicate. You must first get a proper diagnosis of what causes the bradycardia in your case, and we at Christine.Doctor, as mentioned, can do this for you remotely, or you can address your trusted health practitioner. Link to Christine.Doctor is of course in the description box below. We will help you out. Contact us. In TCM, as you have seen, there are many possible causes for bradycardia. One of them, which we're gonna start with, is heart Qi deficiency. So let's see what the symptoms of heart Qi deficiency are and how we can treat it successfully with natural remedies. The symptoms are palpitations initiated by exercise. The symptoms also worsen after exertion or when you're tired, and they are relieved by resting, a good sleep. You also often have insomnia, dizziness, shortness of breath, diminished vocal power, no desire to speak, physical and mental fatigue, excessive perspiration in the daytime, facial pallor, weakness, suffocating sensation in the chest, cold extremities, pale tongue and swollen white coated tongue, weak or intermittent pulse, anxiety, ectopic beats, dyspnea, anemia, fatigue, lethargy, and in some cases diarrhea. To treat the heart Qi deficiency that causes the bradycardia and all the other symptoms that you see here, we want to reinforce and strengthen the heart Qi and warm also the Yang to invigorate the blood. And the formula that we used for that is Schisandra, a Schisandra decoction. For severe bradycardia, we can also add rhizome, polygonatum, and astragalus. For extreme sweating, we can also add concha, ostrea, ephedra, and tritici levis. We can also use the so-called basal pills, and there are some patented medicines that you can also employ, such as Bai Xiang Xing Wan, Ding Xin Wan, and Ren Shen Jian Pi Wan plus Fu Fang Dan Shen Pian. Another possible cause of bradycardia is heart Qi and Yin deficiency. Symptoms here: palpitations, fatigue, anxiety, irritability, insomnia, emaciation, shortness of breath, constipation, a dry mouth and throat, numbness, a dry cough, coughing with little or no sputum, coughing with blood-streaked sputum, spontaneous perspiration, night sweats, 5-sol heat due to stress, early menses, restlessness, a dry tongue, pale, copious menstrual flow, overall weakness, memory loss, excessive dreaming, fright, overall tired body, dry and hard stool, a coarse skin, a dry throat, a skinny appearance, a pale tongue, and a shiny or red tongue, the tongue with a thin and white coating on it, or no coating at all, knotted pulse or intermittent pulse, and a feeling overall forceless and deficient. And the therapy here, the approach is to deal with the heart Qi deficiency and the yin deficiency that is caused by worry and emotional excess, which injures the heart and the spleen, causes the irregular pulses, the knotted and intermittent ones, due to the yang deficiency and the yin deficiency, and also the generalized numbness that is caused by the exhaustion of yin and wei, lung atrophy due to the yin deficiency. Also, and a strategy on top of that is to augment the qi, nourish the blood, enrich the yin, and restore the pulse. We use, to achieve that, honey-fried licorice formula that is contraindicated, by the way, for those who suffer from diarrhea. Alternative formulas are to restore the pulse is a decoction based on Jian Nao Wan, Bai Ji Yang Xin Wan, Ding Xin Wan, Yang Xin Ning Shen Wan, Bu Nao Wan, and An Shen Bu Nao Wan for calming the spirit and improving cerebral activity. By the way, this is also recommended, this formula, after a stroke. If the bradycardia is caused by a heart yang deficiency, the symptoms are palpitations, shortness of breath, and excessive perspiration, specifically during the daytime. And the symptoms get worse after exertion or when you're tired. Also dizziness, aversion to cold, cold limbs, fatigue, weakness, maybe chills, cyanosis, a suffocating sensation in the chest, depression, facial pallor, clear frequent urination, sudden fainting, a thready and weak or knotted or intermittent or deep and slow pulse, severe chills, not feeling relieved by clothing or covering yourself when you feel cold, slight fevers, anhidrosis, exhaustion, almost constant desire to sleep, headaches, joint pains, pains that penetrate to the back, sore throat, a raspy voice, edemas due to muscle weakness, weak extremities, chronic wheezing, severe pain and obstructed feeling in the throat, a pulse that is soft and deep, headaches due to the deficiency, colds, kidney problems characterized by pain that penetrates from the back, slight fever, anhidrosis, exhaustion, etc., etc. We want to address the heart yang deficiency to disperse the wind cold and replenish the yang. And the formula that we can use is ephedra, aconite in a prepared form, and a serum. For acute laryngitis, chronic laryngitis, kidneys problems, coughing, skin disorders, fibromyalgia, connective tissue disorders, sick sinus syndromes, or our bradycardia, allergic rhinitis, measles, pneumonia, trigeminal neuralgia, bronchitis, headaches, sudden dysphonia, emphysema that is complicated by infection, acute exacerbation of chronic nephritis, fatigue, hypothyroidism, acute exacerbation of chronic prostatitis, acute exacerbation of prostatic hypertrophy, arthralgia, rheumatoid arthritis, alopecia, common cold in weak and elderly patients, bronchial asthma, influenza, allergies, arthritis, blood vessel and nerve disorders, chronic bronchitis, pertussis, viral pneumonia, facial paralysis, sciatica, sinusitis, chronic pharyngitis, chronic obstructive pulmonary disease, nephrotic syndromes, acute exacerbation of chronic glomerulonephritis, urticaria, dyspnea, and peripheral neuropathy. We can, for all of these conditions, it's also been proven to be very beneficial to use this ephedra, prepared aconite, and a serum decoction. If the bradycardia stems from a heart and kidney yang deficiency, the symptoms are chest stuffiness, twinges in the precordial region, palpitations, shortness of breath, dizziness, occasional fainting, fatigue, weakness, dizziness, low back weakness and pain, and aversion to cold, cold limbs, restlessness, insomnia, problems with a pulse or weak pulse, a thready, slow, or uneven or intermittent pulse. And to resolve this, we want to warm the yang and replenish the qi for the kidneys and the heart. And we use a 6 sinus syndrome formula that consists of ginseng, astragalus, polygonate odoratum, rams cinnamomum, and other herbs. And natural ingredients, we can, if the bradycardia is accompanied by additional blood stagnation, we can add salvia, miltiorrhiza, also Angelicae sinensis, Flos chartam, and Paeonia rubra. For heart, blood, and yin deficiency, the symptoms are severe palpitations, irritability, anxiety, that you are easily startled, you have a dry mouth and throat, night sweats, insomnia, much dreaming, poor memory, dizziness, thready or weak pulse, or thready and slow pulse. There's also pulse that is sometimes slow and sometimes rapid. Lung and kidney qi deficiency, heart and lung qi deficiency, lung qi and yin deficiency, muscle atrophy disorder, also known as Wei syndrome, can also be present due to lung heat with fluid deficiency. And as a therapy, we want to nourish the yin, nourish the heart blood, calm the heart and shen, also unblock the channels, augment the qi, generate fluid, clear the heat, preserve the yin, and stop the excess perspiration. And the formula, that is a powder formula that contains ginseng, Codonopsis, Schisandra, and Ophioporgonin. It is a very potent therapy for many severe conditions, such as acute collapse, chronic bronchitis, pulmonary tuberculosis, supraventricular arrhythmias, rheumatic heart disease, post-bypass debility, hemorrhagic shocks, cardiogenic shocks, neurasthenia, palpitations, hyperthyroidism, insomnia. The list goes on and on, as you can see. So These formulas are not only good for treating your bradycardia, but also the whole bunch of other health conditions. And last but certainly not least, your bradycardia can be caused by heart, blood and spleen Qi deficiency. Symptoms are palpitations, insomnia, much dreaming, that you're easily startled, you suffer from poor memory, the forelimbs are tired and lethargic, you don't have a lot of appetite, you have a distension and fullness of the epigastrium and abdomen, loose stools, a shallow complexion, copious pale menses, uterine bleeding or light menstrual flow or amenorrhea, and your pulse is steady and weak. When the spleen is not governing the blood properly, you also notice memory loss, forgetfulness, absent-mindedness, a lack of concentration, menorrhagia, palpitations with or without anxiety, insomnia, also difficulties falling asleep, nightmares, a reduced appetite, a pale and wan complexion, pale lips and nails, early menstruation with copious pale blood, a continuous flow with little blood, excess perspiration, night sweats, irregular menstruation, leukorrhea, dizziness, blurred vision, spots in the eyes, and low spirits. As a therapy, we want to reinforce and to benefit the heart and spleen, augment the Qi, nourish the blood, strengthen the spleen, and nourish the heart. The formula that we use here to restore the spleen is a ginseng and longan combination and an angelica splenic decoction to strengthen the heart and the spleen. When the spleen is not governing the blood, when you have heart blood deficiency, heart and spleen Qi deficiency due to worries, for example caused by excessive deliberations or obsessions, atrophy disorder due to the spleen and stomach Qi deficiency. We have some other patented medicines such as Gui P1, Bai Ji Yang Xingwan, Dangi Ji Jing, Bunao Wan, and Anshen Bunao Wan. So, as you can see, there are many possible causes for bradycardia. It is a treatable disease. You just have to get it properly diagnosed, the cause, and as mentioned, contact us at christine.doctor. Link is in the description box below, and we can do this for you remotely. And we can develop a natural therapy plan that is holistic to address your bradycardia. If you enjoy our content, as always, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to spread the truth and help the channel grow. I also highly recommend that you take a look at the biosphere optimization system. As mentioned, we still have a couple of them left at a heavily discounted price plus free international shipping. In our last video you can see what the Biosphere Optimization System 318 is all about. Link in the description box below. Be quick, and while you are at it, take also a look at all the other powerful holistic health tools that are available at vibrantbody.net. With all that being said, I hope that you've enjoyed this presentation, and until next time, stay healthy.